One of my followers asked why I don't get supplemental oxygen. Can you help others understand why? And is this common among people with ALS?
To be honest, it is pretty common to avoid oxygen in our community. And excuse me, the reason is a lot of patients with breathing problems fall into one or another category. They either have trouble oxygenating or they have trouble ventilating. If you are having trouble oxygenating, supplemental oxygen is what is prescribed. If you have trouble ventilating, we put you on a ventilator. So by definition, what that means is you have difficulty eliminating CO2, difficulty getting a big enough breath to sweep carbon dioxide out. For the most part, if someone's breathing issues are only due to ALS, the ventilator is sufficient. So if we were to check your finger with the pulse oximeter, it's going to be in the 90s. It's going to be 90% or greater of your red blood cells are as filled with oxygen as they can be. So additional oxygen wouldn't do anything for you. It can actually kind of trick your brain into thinking that you don't need to breathe. So it's not okay to give somebody oxygen if they don't need it. So you breathe in order to expel CO2. We don't want you to have too much oxygen. It can decrease respiratory drive. And I enunciate can, not it will, it can. There are times in which ALS patients do need oxygen. So if something were going on with your heart, if you had an infection, if you were fighting something else and you just needed some help, we would need to put you on oxygen, and that would be okay. But right now you don't need it. So we don't ever want to give you anything that alters your blood chemistry if you don't need it. It's another medication. And if you don't need it, we don't need to give it to you. So if I checked your oxygen right now, probably be about 98, 99. You don't need oxygen. If you ever do, we'll know and we'll get you oxygen. And we'll run it right into your Evo. And you'll use both things together.